Officials are concerned about holiday gatherings amid this fourth surge. The CDC warns about 40,000 people in the U.S. could die from coronavirus before the end of the year. So we're going to bring in our chief health editor, Dr. Partha Nandi, now. And Dr. Nandi, booster shots now being recommended against the Omicron variant. So does that mean the definition of fully vaccinated could change?
Yeah, a lot of my patients, Glenda, are asking me the same questions, right? So a person right now is fully vaccinated if 2 weeks after getting the second dose of Pfizer or Moderna's vaccine, or after getting Johnson & Johnson's single dose vaccine, single shot vaccine. As to why and when that term can change, well, I think it'll be based purely on research. At the moment, we really have very little data, minimal data on this new variant Omicron. What we really don't know if a large percentage of fully vaccinated people can develop severe disease. What we mostly have to go on are a couple of very small preliminary studies against this variant. One is from Pfizer, Glenda, and the other one is from the University of Oxford. And they both indicate this, that our 2-dose vaccines are not fending off Omicron very well. Scientists are seeing large decreases in what they call neutralizing antibodies. Those are the antibodies that can knock out the coronavirus. But these tests were done in the lab. What we really need is real world data. And we need to look closely at what this data is telling us. If we find out, Glenda, that our initial vaccination regimen is not protecting us against Omicron, we don't know this yet, but if we find this out, and then we find out that the booster shot is doing a great job of fending off this variant, that's when I think that the definition of fully vaccinated will change.
So, Dr. Nandi, speaking of real-world data, the UK reporting its first death due to the Omicron variant, and it's been reported 10 people have been hospitalized there. What can you tell us about this?
I was really unhappy to hear about the first death. Super unfortunate. We don't know many details at all about this person, right? We don't know if they were fully vaccinated or vaccinated at all, or did they get a booster? We don't know their age, if they had underlying health conditions. All these things are super important to know. As for the 10 people that you talked about that have been hospitalized in the United Kingdom, we know that their ages are between 18 and 85, and that most have had 2 vaccine doses, right? Again, limited data, but that's what we know. We need the full picture in order to understand who's at risk and if our vaccines are helping out or not. One thing that we can take away from this is this: stop thinking of Omicron now as a mild variant. We have to protect ourselves the best way you can. And you said it, that's by getting fully vaccinated, and get fully vaccinated first. And if you can get the booster, please do so. We'll again give you more information as Omicron as it comes, but we really would not think of it as some mild variant. Get yourself protected, and that's how we're going to beat this virus.
All right, Dr. Nandi, thank you for the update.
My pleasure.
And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or you can send it to us on Facebook or Twitter, and we'll get it right to him.